Hello and welcome to today's program. I'm your host, Beatrice Chariot. Today, I want us to go through how to maintain good hygiene. Good personal hygiene is one of the most effective ways to protect ourselves and others from illness. This means washing your hands and also your body. And these good habits can help control our body odor and bad breath as well. Hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases in our everyday life. Home hygiene pertains to the hygiene practices that prevent or minimize diseases and spread in our home. Hygiene and home in our home involves hand hygiene, respiratory hygiene, food and water hygiene, general home hygiene, care of domestic animals, and care of the sick whenever we have someone sick at home. Preventing the spread of infectious diseases means breaking the chain of infection, and when the chain of infection is broken, infection cannot spread. What are the main sources of infection in our home? They come from people who are carriers or are infected, foods, particularly raw foods, and water, domestic animals, and areas that accumulate stagnant water, like the sinks, the toilets, the waste pipes, cleaning tools, face clothes, and all that. Safe disposal of human waste is a fundamental need, and poor sanitation, especially in our low-income communities, is a primary cause of diarrhea. Germs can also spread through the air. What is personal hygiene? Personal hygiene involves those practices that are performed by an individual to take care of one's body health and well-being through cleanliness. How do we benefit from good personal hygiene? There's reduction of personal illness, healing from personal illness, optimal health and sense of well-being, social acceptance. You smell good, you smell fresh. There's also prevention of spread of illness to others. What steps can we take to get this good personal hygiene? Bathing regularly, washing hands regularly, especially before handling food, washing the scalp hair, keeping the hair short where necessary, or shaving, washing and hanging clothes in the sun to dry, wearing clean clothes, ear cleaning, that is something that is forgotten most of the time, brushing one's teeth at least twice a day, keeping our fingernails short, covering one's mouth when coughing, disposal of soiled tissues appropriately, making sure our toilets are clean, and making sure food handling areas are clean. There is also personal grooming, which pertains to maintenance of good personal hygiene and public appearance, including the use of deodorants and perfume, shaving and combing, besides other practices. Let's look at hand washing, something very key in preventing spread of infections in our homes and in our lives. When we wash hands, we reduce diarrhea by almost 50% and respiratory infections by nearly 25%. And also incidences of skin diseases and eye infections and intestinal worms are prevented. So let's teach each other, let's teach our children, let's teach all around us and remind each other to do this. We should always wash hands after using the toilet, before making or eating food, after handling dogs or other animals. And if you've been around somebody who is sick or you've gone to hospital, so you do wash your hands or do hand hygiene as you go into the hospital, and when you come out also, you must wash your hands. How do we improve our body odor or body smells? By having a bath, ensuring our skin is clean, also wearing clothes which are washed, including the underwear and socks. Some people suffer from bad breath. Sometimes it's because of not regularly brushing and flossing, but also can be caused by diseases of the teeth, the gum, and the mouth. And this you need to visit a doctor, a dentist preferably. We also have foods that can cause bad breath. For example, garlic and onion, and many people know about this. Mouthwashes and mouth sprays and flavored chewing gums can help us smell better. Remember, if you have health problems in your mouth, you need to see a dentist. What are the ways that we can do to reduce spread of infections? This includes washing of hands frequently, as we have stated, staying home if you're sick, do not spread illness to other people, using a tissue or a cough or sneezing into your arm, not into your hand, turn away from people. Disposal of tissues, as we emphasized before, washing of hands after coughing, sneezing, or using tissues or handkerchief. If working with children, have them play with hard surface toys that can be easily cleaned. Avoid touching your eyes, nose, or mouth. When traveling, drink only bottled water. And when you wash your hands, make sure they're totally dry before you touch any food. Do not wash fruits or vegetables in unsafe water. If you have no other water source, make sure the water is boiled before you drink it. And lastly, 2 things to remember. Good personal hygiene is one of the most effective ways to protect ourselves and others from many illnesses. Secondly, washing your hands regularly, especially before preparing and eating food, before and going to the toilet, is very key also in preventing infection. Thank you. I hope we have all learned today, and remember to subscribe to this channel so we keep learning, we keep improving, we keep getting better.